What's up everyone, welcome back to my channel. In today's video I'm covering what life is like as an orthopedic PA, so stay tuned. For those of you that are new to this channel, I graduated PA school in June, I sat for my board exam in July, and then I started working in orthopedics in October, roughly a month ago, about 5 weeks ago. I'm really loving orthopedics, I'm learning a lot each and every day. I just started to go into surgery more, so I'm getting more hands-on experience in the OR, which has been awesome. Whenever I started working, I got 2 weeks of training and shadowing. I actually did a rotation as a student at this clinic that I'm employed at now. So that definitely helped understanding the flow of things and how everyone operated in the clinic. So after those 2 weeks were up, they started scheduling me with my own patients. I started at about 1 patient an hour. This is my 4th week now, seeing patients on my own. Some days are busier than others. I'm averaging, I would say, around 10 patients a day. Some days there might be fewer, some days there's more. Last Friday was a record for me. I actually got up to 16 patients. I saw 11 in one afternoon, so that was a lot of fun. It was a little bit stressful, but I think I handled it well. Just seeing that volume of patients is good experience for me going forward. My schedule is Monday through Friday, 8 a.m. to roughly 5 to 6 p.m. That can change depending on what the afternoon is like, how many patients are scheduled, but generally around 5 o'clock is whenever we're done. I don't take call, I do not work weekends or holidays. The doctors in our clinic take all the call, which is nice for us PAs that work there. Starting here pretty soon, I will be going into surgery every Wednesday. So Monday, Tuesday, Thursday, Friday, I'll be in the clinic seeing patients, and on Wednesdays, I'll be in surgery with our spine surgeon, first assisting him with cases relating to the spine with discectomies, lumbar cervical fusions, SI joint fusions, those kind of things for the most part. A lot of people think that PAs in orthopedics are always going to be on call, they're always going to work weekends, have really bad hours, but there are jobs out there where you can be in a clinic and have more of a regular schedule and also get time in surgery without having to work weekends. My clinic has 7 docs, 5 of which are surgeons. The other 2, one is a neurologist and one specializes in more of the non-surgical techniques. She's more of a physiatrist, so if we need injections, like epidural steroid injections for back pain or radiculopathy more so than back pain, she does those for us, as well as epidurals in the cervical spine. She does median branch blocks and then radiofrequency ablation, so that's what she specializes in. And then as far as our surgeons go, we have a knee and a hip surgeon, actually 2 of them, an upper extremity surgeon who does all of our hands and elbows and shoulder surgeries, and then we also have 2 spine surgeons. As far as the patients that I see goes, it's basically general orthopedics. So I see every joint in the body, with the exception right now of our spine patients, which is ironic because I'm going to surgery with our spine surgeon here pretty soon. The reason for that is more so being that spine patients are more complex to diagnose and to work up. The imaging is a little bit harder to interpret, with that being the x-rays of the lumbar and cervical spine, and then the MRIs as well. So I'm still learning how to do that. But right now I'm getting a good grasp on the rest of orthopedics. So knee pain, elbow pain, hand pain, any joint in the body that is affecting someone, I have the ability to see that patient and diagnose them and treat them on my own. So that's been really fun, and I'm really honing my skills when it comes to those things. I'll start seeing more spine patients in the future, but like I said, it's just more of a complex workup. What's really nice and what's comforting is that whenever I'm in clinic seeing patients, I always have a surgeon there to back me up. If I ever have questions about anything, if I want an x-ray reviewed with someone, I can always rely on one of our surgeons to come over and just confirm that, my treatment plan that I decided on is correct. And if the surgeon would have any recommendations, they express their concerns to me or whatever they would recommend for the patient, and I listen to them, and then I make adjustments if needed. So it's really awesome. We collaborate well together. I feel like I've only been there for a month, but it just feels like it's a really good team effort amongst all the providers in the clinic. I also forgot to mention earlier that on top of the docs that we have in the clinic, there are 2 PAs, myself and my brother actually, and then we have 2 nurse practitioners. So I mean, it is a very busy clinic. We're more in a rural setting. We're about, I would say, 80 miles east of St. Louis in Southern Illinois, so we serve a lot of area. There aren't many dedicated orthopedic clinics in the region that I'm in. What's also really neat about the clinic that I'm in is that not only do we have x-ray, but we also have an MRI machine, which is actually brand new. We had an old one, but this newer one gives us some really good images. So we have x-ray, MRI, we have a DEXA scanner for our osteoporosis clinic, and we have physical therapy right there on site on the other side of our building. So we have all of those resources available to us. So when patients need those services, it's right there. They can easily access them. It's easy to get that imaging for them when it's needed. What's also cool about orthopedics is that you get a fair amount of procedures or injections while you're in the clinic. So it makes things fun. It changes up the day a little bit. It's not just you talking to patients all day long, you're actually hands-on doing things. So we do a lot of injections for like osteoarthritis in patients' knees, medial and lateral epicondylitis. We do injections for, we do aspirations for joints that need them. We do injections for bursitis, so like greater trochanteric bursitis is a pretty common one that people get. Injections for trigger fingers, so when patients are having locking, it's usually in the ring finger, it can be the middle finger, it can be the thumb too. We do injections over the palmar surface of the hand, which are actually pretty painful. I've never had one done, but just from patients' experience, they don't like that one as much as, say, one in the knee. Injections for rotator cuff tendinitis or tendinopathy that patients get. So we stay busy doing a lot of different kinds of injections, and like I said, it makes things fun. It switches up the day a little bit. You're not just talking to patients day in and day out. And then of course, we see a lot of fractures, so we're always putting patients in casts or for ankle sprains or putting them in boots. So I really like orthopedics for that reason, is that every day is a little bit different. You're not stuck with one specific joint seeing the same thing every single day you go to work. There's good variation in ortho as a PA, because you're seeing the general orthopedic condition, so everything's coming to you, which is awesome. So that's about it for this video. As a new PA in orthopedics, I'm loving it. I'm loving my job. It's been awesome so far, and I've only been there for a little over a month. So I can't wait for what the future has in store for me. I can't wait to continue to learn, because as PAs, that's basically what we go to school for, to practice medicine and to continue learning and getting better each and every week, each and every day. So again, thanks for watching, guys. If you have any questions or there's anything that I didn't address in this video, don't hesitate to leave a comment below and ask me, or message me on Instagram if you want to. I'd be happy to answer those questions for you. So please like and subscribe to my channel if you haven't yet. Hope you all have a wonderful day.